Are you guys ready? Seeing no thumbs up. Just kidding. Okay, so kind of a busy end of year. Um, and I feel like 2025 might have been the longest year ever. I don't know if people had that experience, but I definitely did. Um, but I'm going to go over a little bit of what that looked like. So for folks who don't know who we are, we're Americans for Safe Access. We were founded in 2002. And we are medical cannabis stakeholders who have come together to create a national medical cannabis program that treats cannabis like any other medicine and prohibits any discrimination for medical cannabis patients. And so it's a big mission, and definitely when I was a cocky 25-year-old back in 2002, starting the organization, I didn't realize how big this mission would be. But it's been an honor, and I'm excited to see the ball rolling. So this is what we're going to go over. I'm going to start with just kind of talking about the current political landscape. I feel like every person I've talked to in the last few months has really uh, a lot of information about sort of one perspective. So I want to just take a minute to kind of show you guys everything, everything that we're dealing with in the political landscape. What it means to show up next year. There's going to be a lot going on. Um, Going back to movement building, we still have 90% of the public that agree with us. We need to find them and mobilize them. And um, uh, the and then finally, we're going to talk about an action pledge. We're going to go back to old school organizing. Uh, but I think sort of uh, my big takeaway from this year is that even though we weren't in all of the headlines about the news that was happening around medical cannabis, we definitely have not been sitting on the sidelines. The reason we're having any of these conversations about medical cannabis is because of patient advocacy. And I know a lot of people have, it's been a long slug. And maybe people have been waiting for um, the next, the next stage, and just want you all to know it is here. All right, let's get into it. So, you know, I think that this is something that's often forgotten. So I'm going to start really like why we're here, like why medical cannabis is an issue. And in this country, there's 30 million Americans who have rare diseases. 95% of those diseases have no FDA approved treatment. There's 129 million Americans that have at least one chronic disease. 1/3 of Americans live with chronic pain. 10% of Americans have intractable pain from either migraines, cancer, degenerative disc disease, central pain syndrome, arthritis. And that means that they're in so much pain that they can't function on their own. They can't work. And this is the state of our country. This is if you look around, 10% of Americans, are in so much pain they can't get up and start their day. You have a million Americans that are living with MS. We have at least 1 million people who have uncontrollable epilepsy, which means that there aren't treatments available. Every year, 5,000 Americans receive an ALS diagnosis. A third of our veterans have conditions related to chronic pain. And we know that chronic pain actually doubles the risk of suicide. And unfortunately, we still have, 19 veterans in active duty military that are committing suicide every day, every day. There's 224 Americans die each day from some type of opioid overdose, and 20% of those are prescriptions. Half of Americans who are 65 or older take 5 to 20 medications daily. 750 Americans over the age of 65 are hospitalized every day due to a serious side effect from medications. And all those medications that Americans are on, 9 out of 10 of them are only palliative. They're they're not making them better. So when people say, especially our opponents say that, cannabis doesn't cure anything, I'm afraid, not being in pain is a cure for that day. And as a society, this isn't just something that we can, brush under the rug. 90% of the 41 trillion spent annually on US healthcare is from chronic and mental health conditions. There's a price tag of 560 to 635 billion annually from chronic pain. That includes like people not being able to go to work. And 35 billion is spent on the cost of opioid misuse, right? This isn't, there are people who need opioids, and we're not saying they shouldn't have access to them. But this is, all related to misuse or to, overdoses. And now here we are, we have over 6 million Americans that we know are participating in some way in our state medical cannabis programs. We know that the through the hemp markets, those numbers, I've heard everything from 20 more million to 70 million Americans that are utilizing cannabinoid medicines. 22% of veterans are currently using cannabis to treat their conditions. 82% of veterans say they'd like to see it federally legal. And today, two-thirds of medical professionals recognize that cannabis has medical value. And I have to say, these numbers, are pretty amazing, especially if you could have seen these numbers back in 2002. But this isn't just people saying, taking our word for it, right? We have, the National Academies of Science and Engineering and Medicine came out with this report in 2017 that said that there's conclusive and substantial evidence that cannabis and cannabinoids are effective for treatment of chronic pain in adults, as anti-nausea treatments for chemotherapy, and for improving the symptoms of MS. This was in 2017, right? Almost a decade ago. And of course, this was buried. Now, all of our talking points are actually coming from government agencies, right? This is from the FDA. They said that none of the evidence from their systematic reviews included in their analysis. So this is around the rescheduling, or the recommendation for Schedule 3, um, demonstrated substantial safety concerns that would argue against the use of cannabis in any of the indications um, where there's benefit. So let that sink in. Like the FDA is saying, like there are no risks greater than the benefit of medical cannabis. And now here we are, into this experiment, and we've learned so much at the state level, right? We've learned that we can improve patient outcomes, we can lower healthcare costs. There's benefits to the overall workforce. We've reduced opioid dependency, and we're sort of waiting for science to catch up to these findings. But we also know, um, from the data that we've supplied as patients, right, that um, people are turning away from pharmaceuticals. Um, and again, for people where pharmaceuticals benefit, I'm not trying to demonize those at all. But for many people, the side effects, and I'm one of those people, that the side effects are just intolerable, right? We look at, 50% of Americans that are 65 or older have one or more rheumatic condition. And here we see um, that 62% um, of Americans who are using cannabis are actually substituting cannabis for other medications. Right? This is exciting data, and this data only exists because of the work that you all have been doing at the state level. The reason that we have been able to get to the next phase is because of your work. But if you're a medical cannabis patient, you're very aware that it is a big deal that cannabis is illegal federally, right? That um, we don't, we can't deduct our cannabis expenses through Medicare or Medicaid. Veterans are paying out of pocket for that 22% that are using cannabis. That's all coming out of pocket. That people have a hard time traveling or relocating for work. People can't go to college in the state that they want to because there's no reciprocity laws. Uh, People are finding at their end of life that they can't use cannabis. They can't die the way that they want to because they can't use cannabis in hospices or assisted living facilities. Patients are putting off surgeries because they can't use cannabis in the hospital. And we have no rights, right? We medical cannabis patients, we're not protected under the Americans with Disabilities Act or the Fair Housing Act. The federal government sees us as criminals. And we also can't own a gun. And yes, there are some cases that are making their way up to the Supreme Court, but those are going to protect a very narrow class. So there's a lot of conversations about, why can't patients just get their cannabis from the adult use market? And I think, it's great that I want anyone who wants access to cannabis should have it without going to jail. But patients, we need recognition as a medicine because I'm not interested in creating, safe access for only the privileged Americans. There are 43 million people who are living in poverty that can't pay for out-of-pocket costs to go to doctors or to cover their medicine. I think we've been fighting for decades. We might as well get this right. Uh, you know, we don't want to go from having, where, your zip code determining whether or not you have access to medical cannabis to what's in your checkbook. Not that anyone has a checkbook anymore. Um, we look at our veterans populations. I mean, this is a sad state of affairs for this country overall. Um, but are we just going to say to those 1.2 million veterans living in poverty, good luck? I think we can do better. AARP is reporting that 1 out of 5, adults over the age of 50 are using cannabis. Well, Medicare doesn't cover the cost of cannabis. It doesn't cover it doesn't cover the ID card. It doesn't cover the medicine itself. And so, the 8.2 million older adults living in poverty, this is just not a possibility. Active military can't use hemp products. They can't use medical cannabis. I mean, this is uh, criminal. So we know patients can't travel where they want to. Maybe they're missing weddings. I know I've missed some life events because it's just not safe for me to travel with my medicine. And again, look at all of these patients who are all these people who are enrolling in hospice every year. 1.72 million people are not getting to choose the death that they want. People in long-term facilities. People can't live in HUD housing who are medical cannabis patients. And 25% of those 10 million Americans that are living in federally subsidized housing are disabled. I mean, this is a sad state of affairs, but this is why we have to change federal law. So if we know on one hand it works for so many, we have to make sure it works for all. And this is, the work that you've been doing in the States. This is how we got here. This is how, HHS and FDA found that there is currently accepted medical use of cannabis. And that was just backed up by the president in an executive order. Very exciting. But the president can't legalize cannabis. He actually doesn't have the power to do that himself. And so we'll get into the details of the executive order in a second. But there's some other things that the president can do if he's so supportive of cannabis that I hope he will. That he could stop these evictions in federal housing. He could allow VA doctors to recommend cannabis. He could stop drug testing of federal employees. He could create some guidance, the DOJ, for the people who are giving us access. And he can tell Congress, put something comprehensive on my desk. But we have some real enemies. And I think that for folks on social media, especially in the last few days, might have been really focused on the executive order and what it could mean, and maybe didn't notice that the day before the executive order, 26 members of Congress sent a letter to Trump saying, please do not reschedule cannabis. Do not do this. And there's some pretty important members of Congress on there, like the chairman of the Ag Committee, Andy Harris, the chair of HHS, Adderholt. Um, and so this is the 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 temperature in DC isn't just all, full steam ahead. Same day, 22 Republican senators signed on, and these are also key. I'll show you in a second. Very key individuals that hold our future in their hands. We also have, organizations like SAM that are organizing that honestly a lot of their talking points sound a lot like some of the cannabis activists' points about the cannabis air quote industry. There are parents groups who are really confused and really scared about seeing cannabinoid products all over this country that are organizing and that are telling members of Congress they just want it to go away. Our Sam is really fundraising off of this, right? He's getting ready for they're getting ready for the year that we see ahead. And we see real consequences of these letters. It's not just like a simple sign-on letter. Last year we saw a sign-on letter of 25 Republicans that came out against the Schedule 3 findings. And those a lot of those members are now in key leadership. So, the and in key committees as well, right? We see chairs of every one of these key committees for us. CJS, this is the Department of Justice, the people who control their budget. HHS, all signatories of the most recent letter and the letter last year. Here are the chairs of Ag. So, um, it's not all positive. We also know that, that this administration has been following, um, Project 2025 as a bit of a blueprint. And there's some pretty scary stuff in there about drug laws that are maybe a little hidden from folks. We saw, right before the shutdown that there was somewhere there was a memo from the Department of Justice sent out saying that the U.S. Attorney should prosecute simple marijuana possession on federal land and national parks. The executive order didn't rescind that memo. Um, you know, we see some very sort of technical components. None of them say cannabis specifically, but if you read between the lines, this could be pretty frightening to see the federal government come in and enforce, especially when so many of us, because of our state laws, are forced to depend on the adult use market that has no federal protections. Um, and so, a lot of the language that they use to talk about interrupting state laws, they talk about RICO, but I think maybe they don't know that they could enforce federal cannabis laws. And let's hope they don't figure that out anytime soon. But, right before the shutdown, there was actually a hearing in DC um, that was called by a Oklahoma congressman uh, about illegal Chinese cannabis grows. And, you know, while a lot of people were laughing about the subject matter, what is key about this is there was actually two people that testified at that hearing. One was a narcotics agent from Oklahoma, and the other was someone from Heritage Foundation, one of the key contributors to Project 2025. And at the end of that hearing, what they called for was a RICO task force on marijuana. So we also saw a lot of those same Republicans that were on that list. They passed amendments in their version of the CJS appropriations bill, one that would stop the rescheduling process. So whatever Trump just did, like they could actually just stop it by not giving the Department of Justice money. And they also modified our medical cannabis amendment, the thing that has stopped the federal government from raiding medical cannabis um, uh, suppliers and patients for a little over a decade, they've actually modified it, saying that actually the federal government can enforce cannabis laws in special use zones. Um, and so the language that they use is that they could enforce in USC 860, and in most of our state laws, we have protections around schools, right? You can't have a dispensary right next to a school, but the special use zones at the federal level are much more comprehensive. So any dispensary, cultivation site, manufacturing site that was in 1,000 foot of not just schools, um, but also colleges, junior colleges, universities, playgrounds, housing facilities. So any sort of federal housing, or 100 feet from youth centers or swimming pools or video arcades because it was in the 80s. And it's not just that they could enforce cannabis laws, but actually any drug activity within those zones, it's twice the punishment, right? Twice the fines. So a 10-year mandatory minimum becomes a 20. Um, and this is in the current House version. On the other hand, one of the reasons we went to the states was part of it was because of the Controlled Substance Act, but also part of it was that there isn't a pathway for medical cannabis at the federal level. There's not a pathway for complex botanicals. And so when we're looking at the history of medical cannabis, it's much more complex than just the criminal justice side. And, this is where, as we move forward and start seeing more pieces of legislation, we really have to be careful about how cannabis regulations move forward. A lot of the bills that we saw in the last Congress and in this one that are calling to regulate cannabis are using language from the Tobacco Control Act. They're putting, FDA in charge of cannabis, and where FDA has been very clear about how we can get access to medical cannabis. They say it has to go through the botanical drug approval. Um, if if cannabis isn't a medicine, we're not protected under the ADA or Fair Housing Act. Um, to remember our history, that there used to be a national medical cannabis program, and when Bush Sr. sent it back or closed it down, we went to the states to start the great experiment we're a part of. But we were also, looking at, what was keeping cannabis in Schedule 1. And over the last 30 years, we've chipped away at all of these barriers, right? Almost every state, but Idaho has some type of medical cannabis program. We've been able to create product safety protocols for the supply chain. We changed the scheduling of cannabis in UN drug treaties, and HHS, of course, and FDA are behind us. And so this is sort of what it feels like, right? And has for a while. And, you all are all responsible for helping flip flip this board up. But where these fall is going to be almost just as important as getting them unstuck. So what we wanted Americans safe access, what we've been fighting for is we saw, the state programs, they were triage for us to get patients off the battlefield of the war on drugs while we figured out all of these things. And we want to see cannabis transition into our healthcare system, not pharmaceuticalization of cannabis. That's not what we're fighting for. We're fighting for a change in the definition of medicine. We want to see plant medicine go directly to patients, and that means that we still have some work to do. Oh, we're so close. So, what we've been working on for 2 decades is actually similar to what we've helped other countries pass, which is the creation of an Office of Medical Cannabis and Cannabinoid Control in HHS, not in FDA, and a new schedule for cannabis. It doesn't fit any of the existing schedules. And there are definitely a lot of people out there that want to see it descheduled, but I just don't think our country is ready for that. But descheduling and decriminalization are not the same thing, because Schedule 6 would be decriminalizing cannabis. So we've been working with Ledge Council to get this legislation introduced. This is this idea isn't totally crazy. As Congress has been looking at how to move forward, definitely creating a new schedule has been a part of that discussion. Creating a new framework, regulatory framework, has been a part of that conversation. And so, we have a busy year coming up. So that's the political landscape, right? It's not all like, there's a bunch of good headlines and people are talking about cannabis and it's going to make a lot of money. Like that is not the picture from DC. So with that in mind, I want you guys to know there's a memo that we've created that this is actually a memo that we sent to Congress at the end of the year, um, that is available to you all as well. But almost everything I'm going to talk about in this next section is in this memo. And again, I'm also going to share the presentation with you all. So there was an executive order. There's a lot of different headlines that came out of this. Um, what's interesting is that you know that there's an issue when the takeaway from an event is being reported the same way from our opponents and publicly traded companies, cannabis companies, right? That we're all saying cannabis was just rescheduled. That is not what happened, right? Our opponents are raising a lot of money under this idea that um, that that changing the schedule of cannabis is going to, create a big loophole for businesses. But this is what it actually says. And again, there's also in that memo, there's links to the actual language. So, don't take my word for it. Read it yourself. Section 2 is really where we get into the meat of what the executive order does. And you'll notice the executive order, it directs other people to do things, right? That doesn't actually, he directs the attorney general to move forward with the rescheduling process. He directs his deputy chief to work with Congress about, finding some better definitions for hemp. Looking at the THC levels and the definitions of containers. But this again is his staff working with Congress to try to create some mitigation from what we just saw in the hemp provisions. He directs HHS, FDA, the CMS and NIH to develop research methods and models utilizing real-world evidence to improve access. This actually comes directly from language that we've been using with lobbying the administration and Congress. So, but again, here's the kicker on that part is that it's that these are implemented as long as there's the available appropriations. So all of these are basically HHS has been directed to implement them, but only if they have the money to do so. And um, President Trump signs a lot of things, but he can't sign checks. And so, the process that we're looking at started with Biden back in 2022. HHS then recommended Schedule 3. Then the Department of Justice put out a notice of rulemaking. That rulemaking then led to a hearing. That hearing had selected its witnesses. It was about to start, and then in January it's postponed. And we've just been stuck here since January. And so this is the process. Sorry, I've got to jump in my slide. This is the process that scheduling or rescheduling of any drug has to go through. And so right now, the Attorney General can either direct the DEA to move forward. They can take up the existing ALJ hearing, which honestly is a bit of a mess. They can post notice of a new hearing to move forward. The Attorney General can, if she sees that there's a legal pathway, although it's arguable, to move forward with changing the schedule. But the statute said there has to be a hearing. And with such a large impactful change in law, um, not having a ALJ hearing could create a lot of chaos down the road for the judicial review that happens after the final rule. Right. So it's like Trump just kind of got this ball unstuck, but there's still a process ahead. So cannabis is not Schedule 3. And hopefully we'll be resuming a process that started in 2022. Um, there's a lot of misinformation about what rescheduling does. There's a lot of people who are very afraid. There are a lot of people saying that it does a lot of things that it doesn't. But the most important thing for our work is that it recognizes that there's accepted medical use, right? And in the fight that we've been fighting, um, you know, if there's a consensus that cannabis has medical use, then getting people to figure out how to get it to patients um, should be our next step. That should be the next act, the next chapter. This information that is put out that if cannabis is Schedule 3, then businesses will be able to deduct business expenses. Um, it's inaccurate. I mean, what is true is that Schedule 3 would mean that the classification 280E would no longer apply. But 280E is just one line of tax codes. Um, and tax law is very clear that if you whatever you do, however you make money in this country, you have to pay taxes. But if it's illegal, you can't deduct business expenses. And so I've put this language in here. This is actually what the proposal says, just so you have it as your reference, but I'm not going to spend too much time on there. Um, but I did want to reference sorry, my big jump in there. A couple things. And one is that the Department of Justice went out of its way to say if cannabis is Schedule 3, it doesn't make what we're doing in the states legal, right? The access that we've created at the state level, we have sidestepped the Controlled Substance Act, right? So when it was Schedule 1, we were acting in a non-regulated way, and if it's Schedule 3, all of that is still outside of the Controlled Substance Act. People say, well, if it's Schedule 3, then they'll start enforcing all of these laws. Well, the truth is they could enforce them now. They just haven't. And so the reality is that Schedule 3 changes the conversation, not our legal reality. And the proposal isn't just to reschedule all of cannabis. It's a pretty complicated recommendation. I'm not going to spend too much time on this, but again, I'm going to send you guys this presentation along with links to everything that I'm talking about here. And if you have if you want like a deeper analysis, I've been trying really hard to get information up for you guys as quickly as I can. And so this is a more detailed breakdown. But we also have a challenge that in Congress, a lot of even our champions think that if it's Schedule 3, then they're off the hook. Then they don't need to do anything else. And so this is really where we're going to have to show up in 2026 to make sure that they know that we still need Congress to act to have safe access. One of our other fears about Schedule 3 is that not only is there misinformation, but congressional complacency is a thing, right? Cannabis is a controversial issue, and if a member of Congress doesn't have to do anything on it, um, I think they're going to try to take that path. But just to reiterate, Schedule 3 does not legalize medical cannabis. It doesn't improve the state medical cannabis programs. It doesn't restore our rights. It doesn't ensure nationwide access. It doesn't protect us from discrimination, and it does not integrate cannabis into our healthcare systems, right? So the reason I keep looking at the congressional complacency is we've lived through this before. At the beginning of Obama's first term, he had while he was running for presidency, he said he was going to stop the raids. And so when he first got into office, we heard from from his attorney general, and then there was a memo that was put out um, by Deputy Ogden that said to U.S. attorneys to deprioritize all federal activity for medical cannabis states, but it did not stop. And in fact, a few years later, we were seeing the most aggressive raids ever. And Americans for Safe Access, we kept track of every single federal interference, but we could not get Congress to introduce the CJS amendment for 4 years because when Obama, his administration put out the Ogden memo and then the Cole memo, they felt like he had it covered. And so, we had to put a lot of pressure on politicians in DC to make sure that we could get the CJS amendment um, introduced again and passed. Um, but it was a heavy, heavy lift. And so this is where, every step of the way in 2026, we need to make sure that the 90% is turning their support for medical cannabis into phone calls to their members of Congress. They have to hear from you. So this is just a little bit of what next year looks like. And this is what is already planned, and this is just at the federal level, right? So a lot of things come up. There's a public comment period that there's a deadline for that I think is a great opportunity, an educational moment about medical cannabis that we can be taking advantage of. But on January 30th, the continuing resolutions for the DOJ budget, those expire, including our protections for medical cannabis. In February, we're going to see FDA publishing their cannabinoids list from the hemp law. Um, then we're going to start over again with appropriation deadline. And then November is when the hemp provisions take effect. So it's a busy year. It's the busiest year we've seen in a long time. And again, this is just what is scheduled in statute. We know that so much else is going to happen. And Brady, I think I'm going to take a breath real quick to see if folks have any questions before I start getting into what we're going to do about all this.
Oh, thank you so much, Steph. So much great information here. I do have a question, and if anyone else has questions, please feel free to enter them into the chat. So the first question I have is, does ASA feel it's appropriate to establish the Rohrabacher-Farr Amendment as a permanent measure in order to prevent annual budget disputes? Protective legislation is protected patients.
Yes. So 1000%. Like the only way that we can get there though is to change federal law. And that's what the MCCA does. So the only reason, like trust me, when we passed the CJS amendment in 2014, we thought that there was just going to be a couple years before we passed federal legislation. Like it's not good legislation, honestly, right? It was supposed to be a ceasefire, and we know what happens when ceasefires go on too long. So, it was never our intention for us to be in this state for as long as we have been. But honestly, after we passed the CJS amendment, um, a lot of focus went to adult use. A lot of us were really tired. Some people kind of stepped away. And we weren't able to change the scheduling of cannabis in the drug treaties until just December of 2020. So, on one hand, there wasn't the political will to get it done, but there were also still some obstacles. So, one of the reasons I'm so optimistic right now is that all we have to do now is pass federal legislation. And I know that may sound naive, but in order for us to change the status of cannabis in drug treaties, we had to create an international patients coalition, right? We had to lobby the WHO and then the Committee on Narcotic Drugs at the UN level. That was a lift, right? All that's in front of us now is passing federal legislation. Another question, Brittany?
At the moment, that's all I have had submitted.
And
But
are you
again,
looking in the Q&A as well?
yeah, I've checked. So I'm sure you folks are thinking about it. So feel free to put them in the Q&A.
Okay, I'm going to keep going. Okay, and so of course, that schedule is also in that memo, and it actually has links to each of those items. This individual, by the way, who is the staff person who's listed in the executive order for who needs to work with Congress to move forward with full spectrum. Uh, and again, all of everything that we just talked about the executive order and the hemp provisions, which I have some more notes in here for you guys, is in that memo. Okay, so January 30th, we have CJS appropriations and HHS appropriations coming up. Now, CJS, a lot of you have heard about because of the medical cannabis protections. Um, for the it basically blocks the Department of Justice from spending funds to undermine our bill. Um, but you probably haven't heard people talk about HHS appropriations. And what was in the executive order? Oh, right. They need appropriations for HHS to be able to implement those. So everything I'm going to talk about now is going to require concise action. So I'm going to talk about this pledge in a minute, but I'm really hoping that you guys can work with us now to commit to be ready to act when we need to talk to Congress, when we need to get the media's attention. And so for the beginning of next year, we're really going to be focusing on movement building. So this is the appropriations process. It's very complicated, right? Things have to go through with the House and Senate. There's subcommittees, then there's a full committee, then it has to be voted on in the chamber. Then it comes together for a conference report. And so, for the hemp bill, sorry, for the hemp provisions in the agricultural appropriations bill, that language was in the House version. It passed the House version. It was in that side. The Senate version, it was in the original language, but it was pulled out by Senator Ron Paul. But then when it came to conference, because it was in one side, it ended up in the bill. And so the language I was telling you about for CJS, it's in the House version and not in the Senate version. So we really have to hit the ground running um, in 2026 to make sure that Congress knows what's in that bill right now. So first of all, Nebraska isn't in either version, so we need to make sure Nebraska is added. Um, but the language that would again, allow um, the federal government to come back in is in the House version, and you know there's language that would actually block the Trump administration from moving forward with rescheduling. And so that appropriations language, it's in the memo. So I'm just going to keep bringing you guys back to that. I also want to say, that language wasn't in Trump's original bill. And this amazing group of medical cannabis advocates and patient organizations came together in this sign-on bill to Congress to make sure that it was added. So if your organization was a part of that, thank you. Um, and so now we get to HHS, which these are actually amendments that we've been asking for years, but now they're very timely, which is standardizing the data that's collected, which is part of what the executive order is talking about. Um, there's an amendment about actually, having CMS not just look at a pilot program for a small number of people, but actually, do some analysis, like what would be the cost savings at CMS if they were covering medical cannabis? What would those models look like? What would be the cost of implementing that? Let's actually get some roadmap language out of these folks. And then finally, because of all, both in the hemp provisions and then in the executive order, a lot of things are pointing to HHS, to centralize and figure this out. And honestly, a lot of that language looks a lot like the Office of Medical Cannabis. And so why not create it? Let's get it going. And all of that language also is in the memo. I'm not going to spend too much time on this because we did two webinars on the hemp provisions. But I just want to let you guys know this is in here, including the exact language of what was in the bill. So it's here for your reference. Um, I think, the deadline that we will be seeing next year is that we know HHS is going to be defining, what are intoxicating cannabinoids. And then in February, we're going to get this list from FDA of, what are naturally occurring cannabinoids, which, mimic the effects of THC, what's going to happen with that list. I think a lot of people have their theories. And I'll be talking about that a little bit more next year. And if you want more of a deep dive into the hemp provisions, both what's in there, how we got there, what we should do, we did these two great webinars. And again, that'll be in there. We're going to be looking at, some emergency legislation and regulations in the new year, as well as some public education about, the products if patients are going to lose access to these products. And then, everything that we're working on, if cannabis and cannabinoids are considered a medicine, then we won't need loopholes. We'll just need to see how much is covered. And did you know I was going to say it? All of this is in the memo. So we also have a lot of misinformation that's going around that just is not safe. But it's also there's a lot of people kind of spinning their wheels and having debates that aren't actually happening anywhere. So for instance, I'm sure all of you saw on social media this year this sort of descheduling versus Schedule 3. That's not a conversation that's happening in DC. There is the rescheduling petition that was started by Biden that now Trump is reigniting that HHS said that they thought it should be Schedule 3. That's a process that's moving forward. And then separately, there's a couple of bills that have been introduced that would deschedule cannabis that aren't very likely to pass in this session of Congress. And we'll see what happens in the next one. We also saw hemp versus cannabis, right? Those conversations. That is not a debate that's happening in DC. There is the Farm Bill and the hemp language, and now Congress has defined what hemp products are and what they're not. Um, and then separately is all of the cannabis conversation. So, we really need to step up and just, don't feel shy about, correcting misinformation. Sometimes it's fun to think about, conspiracy theories. And, when we're talking about healthcare in the United States, you don't need conspiracy theories when you have a for-profit healthcare system, right? Like if like all of the businesses that take care of our healthcare are for-profit companies. So there's no conspiracy there. They're doing it for a profit. Sorry. Um, I also have the information about the public comment that's in here for you. I'm not going to spend too much time going over it, but it's really exciting. I mean, it's for a very narrow class of patients, people who are part of the SSBCI list. But it's a conversation opener, right? Like they're looking at actually removing this definition of, prohibiting cannabis products from being reimbursed. And again, it's sort of like backwards, the way we kind of have to approach everything. But it says that what's prohibited are cannabis products that are illegal under state or federal law. So possibly that could mean state medical cannabis, or products that are defined and allowed under the hemp provisions. The information about our federal legislation with talking points is also in that memo, along with the other legislation that's been introduced this term, just showing some of the issues we have with it, and really looking at what it would look like if FDA was a part of that process. So now I want to get to sort of where we are and what is one of our biggest challenges in organizing for medical cannabis. And that is that the real battles for patients when it comes to medical cannabis aren't things that it's easy to get on the nightly news, right? All of these are issues um, that affect patients because of the prohibition of cannabis, right? How many of you, have had to choose between your medicine and a household costs? How many worried about child custody, either because of their medicine or yours? Right? This is a constant worry and pain that we deal with, that isn't on the evening news. Um, you know, Explaining to yet another doctor why we're using medical cannabis. I don't know about you, but I am so sick of people using air quotes when they talk about my medicine. It's so offensive. But it's pervasive. And so, but you know what is even more heartbreaking is that the people that are having these experiences, they have no idea that we all give a shit. They have no idea that there are people out there that are trying to organize to make these things better. They have no idea that there's people that with a plan, um, to create a federal medical cannabis program um, and take away this prohibition and these loss of rights, because it's exhausting, right? And it's also heartbreaking. How many people, come to, uh, a point in their life where they're like, I have to choose between keeping a roof over my family's head and using this medicine. And so in 2026, these are the stories that we have to bring to the surface. And the only way we can do this organizing is to get off of the internet, right? The way that the algorithms work with Facebook is that we're only hearing from people who agree with us. If we're going to find these people, these 6 million patients, these 70 million patients who are having these experiences every day, we're going to have to get out of from behind social media and go find them. And so part of showing up in 2026 is utilizing resources like this. It's kind of a silly concept, medical cannabis bingo, the game with no winners, but it's a way to talk about these issues with people who, may have no idea that patients are going through this, or people who are going through this and have no idea that anyone else is. Um, so part of it is showing up, bringing this, bringing your A game, but there's no more sitting on the sidelines. Like this is it. We like the people talk a lot about how hard it is to roll a ball, roll the rock up the mountain, but what they don't talk about a lot is how hard it is to control it on the other side. And that on the other side of that mountain, there may just be another mountain. And so, as we are winning, as things are moving, this is where we have to be vigilant. We have to show up. We have to make sure that members of Congress who are going to be deciding our future know that patients aren't a myth. We're not some talking point, right? We're not some sheep in wolf's clothing. We exist. And we need federal rights. We want to see our medicine a part of our healthcare system so we can get back to living, right? So we can, not have to worry about these sort of two dual lives we have to live in this society. And this is where the action pledge comes in, right? Like again, there's a lot of people who are going to be on the sidelines. We don't need every single patient, right, to participate, but what we do need is those people who are looking for a way to make an impact. We need to funnel them here. And this is what I'm asking of you guys. I'm asking you to commit to rapid congressional pressure. So if there is something happening, I want to build up a list of at least 100 people in every congressional district that can send an email that day, that can make those phone calls, right? We have um, tens of thousands of people who are on our email list that are on our, hundreds of thousands if you look at our social media channels, and the number who actually participate is so depressing. So this isn't just like you'll sign up and get my email and think about it. If you're going to sign this pledge, it means like when you get either a text message or an email from us that you contact your member of Congress, maybe through an email, maybe through a phone call, I'm looking for people who are committed to public education and responding to the media. Instead of, rolling your eyes when you see a bad story in the media, I'm looking for people who can relentlessly write letters to the editor, who can call out reporters, who can lead their community in writing comments on a bad story. Even if you're just saying, "What about the patients?" on every single news story you see, use your voice and put patients back into the conversation. I'm looking for people who can amplify the patient messaging, right? That aren't out there just sort of repeating or responding to how people are talking about cannabis, but are actually leading news stories with conversations, exposing what I was just showing you in patient bingo. I'm looking for folks who are ready to like start organizing again, who like are ready to look within their own network. So I personally have a couple of text message groups that when I post something to social media, I send them a text and I say, "Hey, can you repost this?" Or "Hey, did you see this?" Or "Hey, can you call this member of Congress?" And I'm asking each of you over the holiday season to think about who is your 5 people, your 10 people. Let's get out of social media. Let's not depend on that as the only place where we get information. But who are like the people that you really trust? You're going to say, "Hey, when I send you this message, can you pledge to repost it or to send this along to your 10 people?" This is how we move mountains. This is how we stop the raids, and this is how we're going to get cannabis back into our healthcare systems. I'm looking for people who are ready to who have a printer and want to just print up some of these signs and take them to your dispensary. Like people, dispensary won't let me put up something. Well, put it on the community board next door. Stand outside, hand them out. Take these posters and put them up in your laundromats at your grocery store. Right? Let's get back to some old school grassroots organizing, right? And I'm looking for people who, are ready to not just amplify, but be present to bring patient voices to the network and the organizations that we need on our side. I'm looking for people who want to get trained to do ASA presentations, and who can be ready, when the Elks Club of somewhere in Nebraska calls us and is looking for someone to do a presentation, right? I'm looking for people who are like, "Hey, here's a group that agrees with us. I'm going to give them this presentation on federal medical cannabis." Because what's really interesting is that a lot of our enemies, all of those things I was pointing out, they're actually not responding to medical cannabis. They're responding to something bigger. They're responding to unregulated products. They're responding to intoxicating products without youth education. Most people don't disagree with us. They just don't know we exist, right? Because we have been overshadowed by the business media. It's much sexier to talk about how much money cannabis is bringing in, than to talk about how many people got to have the death that they wanted because their medicine was legal. So, again, I'm going to email this all to you. We also are going to bring back our monthly volunteer, I'm going to call it the volunteer/pledge meetings. You don't have to go to all of these, but just sign up. It's a good time, to check in. On the 21st of January is the next one. And this one is going to be important because we have, the appropriations expiring at the 30th. So when I send this to you, just sign up. And make sure you save the email with the Zoom link so I don't send you the wrong one. Um, but when people talk about how, oh, the lobbyists have this and DC is so crooked, I'm not going to argue that there aren't issues with campaign finance, all these issues. But when it comes to the individual elected officials, they give a shit about what you have to say, right? The power of being their constituent and saying this matters to me is a lot more powerful than the alcohol lobby coming in and saying that they need a favor, right? So I'm giving everybody permission to get your soapbox out. And when somebody is complaining about medical cannabis, just ask them this question. What do your federal elected officials say? And if they say they don't know, then give them the number, give them the action alert, and ask them to call. So we have a ton of resources. Talking to your members of like I get it. It can be scary. I get nervous before meetings. I get nervous before public speaking, and that's why I've made a point to make sure that you guys have the resources you need to carry out these tasks. So we have um, materials on how to citizen lobby for the legislation I was just talking about. Every single presentation I've given in the last few years about the MCCA, I've written down the questions at the Q&A and created these amazing resources for folks. And again, you don't have to be policy experts. Um, if there's a question you don't know when you're talking about this, send people here. Also, all of the presentations I've been giving on MCCA and other things, like they're all now up on the website. You can download them and give your own presentation. Bring it to your local community. Bring it to your Elks Club or your students group or your local nurses association. We're still looking for endorsements. So if you're part of an organization that wants to endorse and have their logo next to ours on this legislation, looking for it. I over the last year, I went through and I cleaned up and republished all of our activist tools. So this is an updated, getting letters to the editor published. Really went through and updated the messaging and the how to. You can even look up how to submit a letter to the editor or an op-ed in your local paper. Um, whether you're talking about creating like grassroots fundraising or even just a house party to tell people why you're spending so much time on federal advocacy, we have this great guide to having an ASA house party with presentations, ideas. We even have like sample invites. This doesn't have to be boring. Like this can be fun. This is a part of our lives and it shouldn't be separate. So why not tell our friends and family, this is why you didn't see me at the reunion because I can't travel. Fill in your situation. We also have this great report coming out next month, but probably going to see something from me before the end of the year. This is an updated version of our State of the States report. So we're still going to grade the states, but we're going to be celebrating 30 years of state medical cannabis programs next year. And in this document, we're actually going to connect state policy with with federal policy. And it's actually going to be a report that you can use to lobby both your state officials and your federal officials. We're going to be looking at, what is going to remain at the state level, what cool lessons did we learn from the states that we want to have integrated into medical cannabis programs? What are some of the best practices we've learned from? I mean, this has been 30 years and we have done a lot. We got a lot to teach people. Um, we're also going to be updating the grades and really looking at like who's ready for a federal medical cannabis program. If folks want to donate or sponsor, as always, we always have sponsorships for these. And we're still looking for some volunteers. So if you want to chip in and help us, especially like formatting some of the report cards. But we're also going to be doing some deep dives into bigger policy issues like if we don't get medical cannabis from the United States, are we going to be importing it from all these other medical cannabis programs? You know, um, are the current businesses in the medical cannabis space, like, are they making economic decisions that means that they're going to be there to provide us medicine? Um, you know, let's really look at like the really positive impacts home cultivation has had on the available cannabinoids in the market and patients filling in when there has been um, cut off in supplies. Next year is an election year, y'all. 2026, there's you know, a large number of the Senate and um, uh, I think more than half the governors of this country. And so we have the Compassionate Candidate Program. We're asking candidates to sign a pledge saying that they will protect safe access. We'll be putting these guides out early next year. Although, when you guys sign up for the pledge, we're going to be sending you guys to a special place where you can preview some of these campaign documents. If you've never done tabling, if you've never like set up outside of a place of business or gone to a conference, we have these great tools, right? Like just because you're an expert at one thing doesn't mean you know how to do everything. So, organizing, this is my this is my jam. This is where um the advocacy that I bring to the table comes from the organizing space. So please take advantage of these resources. I've created all these posters. If you have graphic design skills and want to chip in, please help me. But I've, designed a bunch of print-friendly posters that won't eat up all the ink in your printer at home. That you can just, if you're on your way to just dispensary, just print one, put it up. Let's try to get to more folks. Before you talk to elected officials or to other groups, we have all of these one-pagers and great looking documents for both state and federal. I am worried about potential things that could be happening with federal enforcement. So we dusted off our raid preparedness materials. They were also translated in Spanish. The holidays are coming up. We have our travel guide. We also have that translated into Spanish. We have our Know Your Rights information for individual patients. Again, I think a lot of people are just going to read the headlines that cannabis is legal. We still have to be safe and make sure that our community is safe. That means even our the products that we're using, the patient's guide. If you haven't seen this document, it's really an amazing way to walk someone through making safe decisions about cannabis use and where to find it. And it is also in Spanish. Our newest action group is actually Cannabis Businesses and Professionals United for National Medical Cannabis. So if you do have a cannabis business, if you did just get your degree at University of Maryland and you want a career in cannabis and you want to find other like-minded folks, this action group has formed just for people like you who aren't seeing themselves reflected in some of the other air quote industry conversations. I just want to say thank you to our sponsors. I know it has been a really tough year. A lot of these organizations have given financially. A lot of them you have just have stepped up and have sent out our information to their lists and helped us with publications or outreach for webinars. So I just want to say thank you guys so much. If you want to become a sponsor, there's more information in this packet for you. And yeah, I want you guys to keep in touch and just look away real quick because I want to go back to the pledge because my goal is to get every single one of you to sign the pledge and to get at least one other person to sign the pledge. Okay, Brandy, I'm going to take a sip of water and let me know if there are more questions.
Oh, thank you so much, Steph. So much great information and inspiration. Um, so I do have a few questions and we also have a few comments.
Let's just take your questions.
So we're going to take the questions. And we did have a little bit of a snafu at the beginning where we sent out the wrong link. So a lot of the questions are from Nikki.
Nice. Yeah, no, you
but
don't have to say who they're from. That's fine.
The first question I have is there is an it's a question of International Patients Organization. Where can I sign up?
So, I mean, Americans for Safe Access, we work within international patients organizations. So it's not like Marine or Mariners Law. The international patients coalitions are individual, like United States. So ASA, we represent U.S. patients. So if you're working with ASA, you're part of those international conversations. Um, but definitely, honestly, right now we've kind of gone from doing a lot of work at the international level to now trying to implement our work in our country. After we changed the scheduling at the UN level, a lot of other countries have moved forward with national medical cannabis programs. And really, what a lot of our international partners need from us is for us to change federal law in the United States. That impacts just because the US has such a big impact on medicines and healthcare across the globe. Next question.
Okay. So, question from Ken. Where is the link to the document that has the comment deadline of January 26th?
So it'll be in this presentation that I send, and I can also I'll pull it out for you, Ken, and make sure it's in the email with the presentation.
Great, thank you. And a related question to that is, will ASA have guidance for the public comments for that period?
Yeah, I'm gonna put out something at the beginning of the year. I will say this, so HHS rulemaking is it's less complicated, right, than rescheduling. So, you guys don't notice this, but every day a federal agency posts a proposed rule change to the Federal Register for public comment. It's a process for it's very unlikely that this will change. Um, and so I'm not feeling like we need a million comments on there. They don't there's not really a hearing process usually for regular rulemaking. Um, Usually what happens is that if they pass a rule and that people have a problem with it, there's a lawsuit that happens afterwards. So right now this language is in there. Um, but definitely we're going to frame it a little bit, but I think what is really important is highlighting that this is happening, right? And utilizing the public comment period um, almost more as a PR tool than feeling like we need to impact the rulemaking, if that makes sense. So for everybody who, writes a public comment, that's an opportunity for a press release, right? So that we're going to be talking about sort of how to utilize that moment to get the narrative back on patients.
Excellent. If folks are, I don't know if they're able to see the question, the Q&A, or not, but in there are some links, and we will also be sure to send those links that were mentioned in the presentation to everyone who RSVP'd. Um, so as far as I can see, the rest of those questions or links
Great. Well, let
in
me
the
just wrap
Q&A.
this up here, Brandy. And thank you so much, Brandy. And I just want to say thank you to Brandy and to Amy and to Karen and Nikki, who have just been amazing volunteers. And I have to say, one of the reasons I'm so optimistic is that you guys may not know this, but we have been like volunteer run for the last few years. I have taken out personal loans and maxed out my credit cards to keep the lights on. Um, but that's because I know we're about to win. I'm not a martyr. We have been working so hard for decades, and this is our time. And if we don't show up, it's really on us. I don't know how else to say it. Like we have queued everything up. We've removed all of these obstacles. And now it's about showing up. And I'm going to do everything I can to make sure that you guys know the who, when, what, and where to show up. We're going to continue to bring you guys uh, training tools and messaging tools and actions. Um, but I really want you you don't have to sign this action pledge right away if you need some time to think about it. But I really want to see 1,000 people on this before we start talking to CJS because we're not gonna move this needle without it. When part of how we got to as far as pushing back the federal government and passing the CJS amendment in the first place was we had a pledge of resistance. And people pledged that every time there was a federal raid that they would show up and protest or they would commit federal civil disobediences. I myself got arrested several times sitting in front of DEA offices or in front of DEA vehicles to stop raids. But we're not asking you to take a pledge to resist because we're with the current now. Like, isn't that so exciting? Like, we're not resisting. We're actually just showing up, right? We need to show we are captains. We got to show people how to navigate this. And for people who are, invoking our name, we need to make sure they're getting it right. This is an exciting time. I mean, think about like how much we've been able to hold on to without very many resources. And look, there's ebbs and flows in advocacy. When we passed the CJS amendment, we had a $2 million budget. I had 7 people full time in DC. And there was also a time when we needed full time legal suing every agency in California. We won all those lawsuits and we didn't need to do that anymore. But now we're coming full circle again. Now we're going to need to start suing people again. So we need that. We need a legal department again. Patients need to have someone representing them in DC, and we've done this before. And again, I don't want to take a majority of money from one donor. I don't want to be beholden to a cannabis company, right? It's much harder, but if we all put in a little bit of money, um, then we know that we're going to be representing ourselves. So I really hope you guys get some rest this holiday season. You're probably going to see a couple more things for me before the new year. Um, One thing I forgot to put in the presentation, but we have the gift of giving offer. So if you want don't want to go into the store last minute, you can make a donation in someone's name, and we'll send them a nice card for you. You get to pick the card. You also get a membership as well, as the gifter getting a membership. Um, I also have some big news that I'm going to be announcing after Christmas. Looks like we're going to have a pretty big matching donor. This is where your small dollars turn into big dollars. Um, and I'm also going to be sending out something about the Laboratories of Democracy report, sort of a teaser with some emergency legislation for states and an opportunity for you guys to weigh in on the grades. And yeah, I'm so thankful to be working with all of y'all. And I'm so excited that we made it this far. And I just kind of wish I could just brush off the last 24 years to get ready for the next. But yeah, ASA turns 24 next year. Um, about this time was when we started getting the organization off the ground, and we have come so far. But I'm stubborn, and I'm sure as hell not going to get this far and let somebody take it away from us. So, uh, sign the pledge. Let me know what you think. You guys all have my email. I know I just emailed you guys a couple times. Stay in touch. And again, Karen, Amy, Nikki, Brandy, I couldn't do this without you. Thank you guys so much. And I'll talk to you all soon. Happy holidays, y'all.